Warm welcome to this talk. Now, I've had innumerable requests to respond to this talk here. This is between Tucker Carlson, of course, and Dr. Patrick Soon-Shiong. Now, Dr. Soon-Shiong is a very experienced surgeon, medical researcher and entrepreneur with 50 years experience. So there's a lot to learn from him. And the reason I'm wanting to do this, as well as all the requests, was it rings true with what I'm being told by doctors in the United Kingdom. It sounds like doctors in the United States are seeing the same thing. So I'm going to do a quick review of the first part of this video as I understand it. So Tucker started off by saying, look, we were told smoking causes cancer, and make no mistake, it does. Smoking is a big factor in many cancers, not just lung cancer, but bladder cancer, pancreatic cancer, other cancers as well. But smoking has gone down dramatically now. It's only about 15% of people in the UK ever smoke now, although we have these wretched vape things, but they're slightly different concern. So smoking's down, but cancer rates are up. What the heck? You know, if smoking was one of the main causes of cancer, we should expect cancer rates to be down, because smoking rates are way down, but cancer rates are up. That's strange. And Dr. Soon-Shiong is seeing more cancers in younger people. And he mentioned the cancers he's seeing particularly in younger people. Cancer of the pancreas, top of the abdomen, ovaries in women, of course, and colon, the large bowel, seeing these particularly. And pancreatic cancer especially, he talks about as having a remarkably poor prognosis. Now, pancreatic cancer is associated with increasing age, it's associated with smoking, and it's associated with chronic pancreatitis. It's way more common in the over 70s. I have seen it in patients in their 60s, but that's less usual. It's associated with older age. Only a few percent, maybe 5-10%, have got some genetic component. The survival rate for pancreatic cancer is appalling at the best of times. Locally advanced disease, 6 to 10 months survival time. Metastatic disease, you're looking at 3 to 5 months survival time. These patients get diagnosed and die alarmingly quickly. Most of them are what are called adenocarcinomas. These are in the glandular tissue. About 90% are glandular cancers. That's why we call them adenocarcinomas. They're in the glandular tissue. Very painful condition associated with weight loss. And sometimes, especially if the tumour is near the head of the pancreas, it blocks the bile ducts and the patients go a bright jaundice colour, a bright yellow colour. I remember the first time I saw someone with advanced CA head of the pancreas, carcinoma head of the pancreas. I couldn't believe how yellow they were. Incredibly yellow. And of course, that's very uncomfortable, very itchy. Anyway, Dr. Soon-Shiong is a very experienced pancreatic surgeon. He's done transplants. I think he did the first whole pancreas transplant, and he's done a lot of work putting in insulin-producing cells and the islets of Langerhans cells that produce insulin. Very experienced in that field. And in all the time he worked in the field, he never saw pancreatic cancer in children. Never. And it's unheard of. Now, I've talked, since I've started watching this video myself a week ago, I've talked to quite a few very experienced doctors, and none of them have seen pancreatic cancer in children and not in young people. Most doctors I've talked to haven't seen pancreatic cancer in people under the age of about 60. You might get the odd case in the 50s, but it's a condition of older people. And Dr. Soon-Shiong has seen a case was referred to him in a 13-year-old. 3 years older than 10. The centre had been treated at, they tried everything. He was referred to him with advanced metastatic pancreatic cancer at the age of 13. Sadly, the child died. If you're a doctor, let me know if you've ever seen this before, because none of the doctors, I've certainly never seen it before, but I've not got massive experience in oncology. But none of the highly experienced doctors I've talked to have seen this before. And I'm talking about doctors with 40 years plus experience, simply haven't seen it. This is new. Something new is happening. He's also seeing it in 40 to 45-year-olds. And this has been described as a non-infectious pandemic of cancers. So we've had a pandemic of an infectious disease. Now we seem to be getting a pandemic of non-infectious disease. Cancer is usually a non-infectious disease. Colleagues of Dr. Soon-Shiong have seen colon cancer, and again, colon cancer, again associated with older age groups. Now, we do get colon cancer sometimes as a result of genetic abnormality in people in their 30s, 40s, even 20s, tragically. It does happen. But typically that's due to some specific genetic abnormality. Colleagues of Dr. Soon-Shiong are seeing cancers in 8, 10 and 11-year-olds. Again, this is just unheard of. 8, 10 and 11-year-old children developing colon cancer. They're seeing a lot of women in their 30s and 40s with ovarian cancers. And to use the term turbo cancers, Tucker asks, are we seeing cancers that are more aggressive, more virulent, higher stage cancers? And yeah, we're seeing more of these turbo cancers. They're presenting with a more virulent form of malignant cell. And these are spreading and causing death more quickly, higher grade malignancies. And also people that are in remission of cancer have been getting the cancers back. And we talked about this with Professor Dalgleish. Oh, Professor Dalgleish has noticed this for a long, long time, but I first learned about this from about a year ago. Professor Dalgleish noticed that people that had booster vaccines, very often cancers that were in remission, that had been basically dormant for 5, 10, 15 years, were being reactivated. Now, in this first part, that's not talked about vaccines, but other doctors I've talked to have seen this. And other surgeons we've talked to on this channel as well. Now, it then goes on to talk about cancer cells. Now, killer cells. So basically, we're all getting cancer every day. We live with cancer. People get cancer every day. But hopefully the killer cells come along and kill it. They recognize it. These killer cells, cytotoxic T cells, type of T lymphocytes, white blood cells, another group of lymphocytes called natural killer cells. If a cell is infected with a virus, then that virus will put abnormal proteins onto the cell surface. And the immune system, the T killer cells especially, they'll just see it and they'll whack it. They'll kill it, which is great. Virally infected cells are killed, and that means the viruses can't replicate inside the cells and spread to. If you don't get viral replication, you don't get other cells infected. Same with cancer cells. There's something abnormal about the chemistry in cancer cells that the immune system can recognize, and they will kill it. But there's a balance between killer cells and suppressor cells. So to get cancer cells, the killer cells need to be inhibited so the cancer cells aren't being killed. And the suppressor cells that normally damp down the killer cells, they're activated. So what we're getting now is not enough activity in killer cells and too much activity in suppressor or regulatory cells. In other words, immunosuppression. These cancers seem to be arising as a result of changes in the immune system, immunosuppressor cells. So natural killer cells and cytotoxic cells are supposed to recognize infected cells. They're not recognizing them. And Dr. Soon-Shiong calls the natural killer cells the first responders to kill cancer cells. But if they're not activated, or if they're oversuppressed by too much activity of the suppressor cells, then the cancer cells are just carrying on dividing. So are the tumour cells hiding from the natural killer cells, the T killer cells? Are the T killer cells down-regulated? Are the suppressor cells too up-regulated? It's something to do with this. He describes it as a yin and yang, a balance. There needs to be a balance, and we're out of balance. That's what seems to be causing these cancers, especially in younger people. Now, if suppressor or the regulatory cells are enhanced, again,